Hi, I'm Dr. Gary Motykie, and I'm a Beverly Hills board-certified plastic surgeon. And today I wanted to go over Kelly Osbourne's transformation because there's been a lot of talk and chatter on the internet about the way she looks and whether she's had surgery, whether it's from weight loss or non-surgical interventions. I think she lost about 80 pounds, which is, hey, congratulations. And I think one of the things people should realize is that whatever the body does, the face follows. So if you lose a lot of weight, you're gonna see it in the face. The face is gonna change, it's gonna shrink, it's gonna change shape as well as the body. And I think there is a lot of that going on here. So she's young enough, she's 36. When you lose weight and you're still in your 30s, your skin will snap back, things won't start to hang. You'll be able to change that shape without needing surgery. So one of the hallmarks of good plastic surgery is that when people see you for the first time, they don't immediately say, oh, you had surgery. They'll say things like, you look good. Did you change something? Did you change your hair? Did you lose weight? Something's different about you. So the interesting thing is the opposite is true. So sometimes when people go and lose a lot of weight and look better and get in shape, they go, something's different about you. Did you do surgery? So it works both ways. And I think so some of that's happening with Kelly, that she's transformed her body and gotten in shape, and that change is in her face. So people are picking up on, whoa, there's a dramatic change in her. And so when I'm looking at her photos from when she was younger and a little heavier to now, you can definitely see some of those changes in the face. You know, the narrowing of the face, the changing of the chubby cheeks, and the neck actually coming up as well, losing some of the submental fat, so the jawline's more chiseled and contoured. Although those come with weight loss and getting in shape. You know, with an 80-pound weight loss, that's pretty significant. So you're definitely gonna see changes in the face. Having said that, I definitely think there are some other changes about Kelly's face that aren't just from weight loss. And then some people may say, hey, you know, she's said to have had a gastric sleeve or gastric bypass, and that's surgical. It is, it's not necessarily cosmetic, but you know, the effects of having that sort of a surgery are that massive weight loss. So there are gonna be some aesthetic changes, like I said, to the body and the face along with that surgery. Now, when we're looking at her face, in addition to the weight loss, there's some changes. Now, she's admitted to some Botox and some fillers and other things, and I can definitely see those changes in her face, because when you do lose that much weight, sometimes you lose it in areas you don't want to lose it. You may lose it, you know, the cheeks may lose volume underneath the eyes, you may get a little more sunken in certain areas, things may change a little bit, and so then you want to add some volume back where you didn't want to lose that volume. There's definitely been fillers into the cheeks, into the mid-face, adding that more heart-shaped face and adding that volume back she may have lost or may have never had in that area. Also, obviously, she admitted to the lips, I think, and her lips are fuller, so she's definitely had some lip filler put into the lips. And then some reshaping with Botox. So Botox can do several different things. When you're using Botox, you can use it for, you know, easing wrinkles and fine lines in the face. You can also use it for facial reshaping. So in other words, you could use it in the brow. She admitted, I think, up to in this area, and that can open the eyes, lift the brows, make people look more rested, as well as battling the wrinkles. And then I'm suspicious of her jawline, or in other words, the width of her lower face, because even with weight loss, it doesn't shrink the bones or the muscles in the face. It may decrease what's in the double chin and bring up the jawline and contour to give it more definition. And the face may shrink a little bit, but not necessarily bones and muscles here. And I can notice that her jawline has significantly narrowed. So one of the things you can do with Botox is shrink the masseter muscles or bring that in as well. So with that weight loss, as the face was narrowing and shrinking, she may have also done Botox in that area. Then she's also gone and done a makeover, right? So she's in a photo shoot, she's pulling the hair up, she's doing makeup, contouring, in addition to the weight loss. All of these things are giving a more dramatic effect that on camera are going to really pick up to being, wow, there's a big change here. Overall, there's a combination of, I think, those non-surgical interventions along with the weight loss. And I think the overall effect is very good. It's very positive. I think she's, you know, really moved in the right direction. Congratulations, because in shaping up the body, she also shaped up her face. And I think overall, it's a very positive change.
Is it a chin implant or really just fillers?
When you're asking me, did she have a chin implant? Do you have other things put into her face? I don't think so. You don't want to underestimate the power of changing multiple things all at the same time. So when you're losing the weight and shrinking the face, then in addition, just adding a little filler, contouring the jawline, bringing in certain areas, millimeters here, moving here, the overall effect becomes very powerful. So I doubt it's a chin implant. most likely it's just some filler to give her a little bit more projection and definition to the chin, in addition to shrinking the outer part. So this is going to give her that nice, elegant neckline. And that weight loss will eliminate that double chin and give contour to the lateral part of the jaw area. And then shrinking this area and bringing this area forward a little bit really now all starts to add up to a really dramatic effect.
Do you think she had a buccal apectomy?
I don't think so. I really don't think she's had a buccal apectomy. If you look at her before picture, she actually has more of a sunken in cheek because the jawline is so pronounced. So as that lower face, the buccal will not shrink this jaw in here and will suck in here. And she doesn't really have that sucked in there. It's nice and soft and smooth. I think she's more likely augmented the upper cheek and maybe the chin as that weight loss came in, but I don't think the buccals were done.
I think the other thing to point out here is that the Osbournes are relatively open about plastic surgery. I mean, Sharon Osbourne's been really outspoken about her admiration for plastic surgery. I don't think we have any reason to believe that Kelly would be lying.
Well, honestly, if she was going to lie, why even admit to the gastric sleeve then? Just say, hey, I did the weight loss on my own, right? Why even mention that? Why even mention the fillers? Why mention the Botox? You know, so I think, yeah, she's fairly open about it. You know, there's some people where you just can say, you're fibbing, you know, that's not achievable.
J-Lo.
But I think the key is when you're looking at dramatic changes in people, like I say, a lot of times you look at the body and the face, when there's a dramatic change of something else going on, then that can really affect the face. So whether it's weight gain or weight loss, and as we see a lot of people go the other way and they gain a lot of weight and their faces become bloated and bigger. And do we see the opposite change where we don't go, oh, they must have had surgery to blow up their faces, right? But when they lose the weight and their face becomes more contoured, they look amazing, immediately we go to, oh, wow, that's dramatic. They must have had surgery, and that's not always true. Like I said, I think it goes both ways. You know, when you have surgery or weight loss, they both improve the way that your face looks.